Hello everyone. Today we have Dr. Lohit Reddy with us. Dr. Lohit Reddy is a radiation oncologist and clinical lead for radionomics and radiogenomics at HCG. Welcome, Dr. Lohit.
Thank you.
Dr. Lohit, the first question which pops up in everybody's mind and definitely would be there in our viewers' mind. What is radiation therapy?
Radiation therapy is usage of subatomic particles to like X-rays, electrons, protons, carbon ions and gamma rays to control and destroy the cancer cells by a process called ionization. This leads to cell death by DNA damage. So this is the basic mechanism of how radiation acts. And by using this technology, multiple technologies, we try to control the cancer.
So, since we understand that there are different modalities which are used in management of cancer, chemotherapy being one amongst them, what is the difference between chemotherapy and radiotherapy or radiation therapy in fact?
Chemotherapy is also referred to as systemic therapy, which is given by tablets or by infusion. So mainly chemotherapy acts systemically, whereas radiation is a loco-regional control mechanism or a strategy what we have developed over a period of 100 years. So with radiation we can use it as a first line of therapy like in laryngeal cancers, or as an adjuvant treatment in cases of breast cancers wherein surgery will form the main modality of treatment and chemotherapy and radiotherapy act as an adjuvant treatment. And in some cases we use radiation in a palliative setting to reduce the pain, to reduce the symptoms. So these are the major differences between radiation and chemotherapy.
The another question which comes in everybody's mind, in fact, I'm very sure that even our viewers would be thinking about it. Who are the patients, or in fact, right candidates for radiation therapy?
70% of the cancer patients require radiation therapy, either in the form of upfront only radiation with plus or minus chemotherapy, or as an adjuvant treatment to surgery or chemotherapy. So mainly it depends again on the stage of the disease, the location of the disease, and also it also depends on whether the patient is physically fit to tolerate treatment as well. So there are multiple factors wherein the radiation oncologist and the medical oncologist and the surgical oncologist as a multidisciplinary team decide on which modality to be used and how do we integrate different treatments to get the best outcome.
Wonderful. So, how is it administered? What are the different ways that we administer radiotherapy?
Radiation is broadly divided into two main types. One is the external beam radiotherapy. The second is the internal radiation or brachytherapy. External beam radiation can be delivered via cobalt machines or linear accelerators, or there's a new technology which is proton beam and carbon ion, wherein we use synchrotrons to generate protons and carbon ions. So the second modality is mainly the brachytherapy, wherein we insert radioactive isotopes into the area of interest, whether it is permanent implants or in the temporary form, to exactly confine to the tumor and deposit our treatment only in the area of interest and protect the normal tissues. With external beam radiation, there are multiple technologies which are available, and mainly we use X-rays in the form of by linear accelerators, which will be delivered by linear accelerators. And with computers and with so much of advancement in technology, we can only focus on the tumor and reduce the doses to the normal tissue, so the side effect profile will be very low, but we are going to get a very good control with the technology available. We in our hospital we commonly use CyberKnife for stereotactic radiosurgery and the radiotherapy, and we also use tomotherapy for the regular broad radiation treatments.
Dr. Lohit, I believe the other very important question which our patients, in fact all the cancer patients have in their mind, and in fact our viewers will have in their mind, about what to do, what not to do when they are on radiation therapy. What is your advice to our viewers for that?
I think the most important advice I would give, people who are advised radiation is to use the appropriate technology. So every organ is different, every organ responds to radiation in a very different way, and every patient is so different and diverse. So you cannot give uniform treatment for everybody. You'd have to customize your treatment. So breast cancer receives certain dose, so and also a certain technology may reduce the side effect profile as well. So the most important thing is to use the appropriate technology for that site and for that individual patient, and we'll have to customize the radiation as well. The other regular advices what we give to patients in the clinic is to have clean diet. Home food is always preferred because the chances of infections are more due to the immune suppression process while they are having treatment of cancer, whether it is systemic therapy or radiation therapy. So it's always very important to have very clean home food, and also to drink a lot of water for good hydration as well. So these are the main broad based advices which I would like to give to our patients.
Thank you so much. Thanks a lot, Dr. Lohit. I'm very sure that this information will definitely help our viewers. Guys, if you have any further questions or comments, you can write down in the comment box below. Thank you so much, Dr.
Thank you.
Lohit, for your time.
Thank you.